This fact about how our heart manages blood pressure is perhaps going to blow your mind. You already know heart is a pumping machine which pumps blood across various parts of our body. And how does heart do that? It is basically a muscle which squeezes and relaxes, and every time it squeezes, it squirts out the blood which is filled inside. Right? So as it squeezes, now the heart is in a compressed state, the blood pressure increases, which is called systolic pressure. And as the heart relaxes, the blood would pump in again for the next cardiac cycle. The blood pressure would come down. That is the diastolic pressure. So diastolic, systolic pressure is 80, 120. That's the normal range. Hypertension is when this pressure increases. And why does this increase? Let's come to that. So now, but before I come to that, let me explain. Think of it, when the heart is squeezing and squirting out blood, how would the blood flow really be? As it squeezes, the blood squirts out, and as the heart relaxes, the blood flow would stop. So the blood flow would really be like it squirts, stops, squirts again, it stops. Now we don't need that kind of a blood flow. We need a steady flow of blood, nutrients and oxygen across the body tissues. So we need to dampen this out. Now our body or blood vessels has this amazing capacity wherein these blood vessels are stretchy. It can expand and it can contract. This is called the Windkessel effect. Now what happens is, as heart squeezes and as the pressure increases, these blood vessels which carry blood out would expand. And as it expands, the diameter increases, the pressure inside it drops. And as the heart kind of relaxes, the blood vessels would contract back again, and this is how our body makes sure that there is a steady state of blood flow. So this squirt stop sort of a blood flow is dampened, and our body makes sure that the blood flow is steady across the various tissues and organs. This, as I earlier mentioned, is the Windkessel effect. Now, primary hypertension, which is when our happens primarily because of bad lifestyle, sedentary lifestyle, lack of exercises, excessive weight. This leads to our blood vessels losing this elasticity or stretchiness. And what happens when the blood vessels are not able to expand or contract? As the heart squeezes and pumps out blood, the blood vessel has to expand, right? And the blood pressure has to drop. But this is not happening. So what happens? The pressure increases. This is one of the reasons of hypertension, primary hypertension, that is. Secondary hypertension happens because of other organ issues such as kidney issues, etc. Now, how do you manage such a primary hypertension, which is what happens because of a bad lifestyle? So, of course, change the lifestyle itself, exercising, losing excessive body fat, all these things helps. A few things which probably might come handier and helpful for you. Reducing salt definitely helps, but not just salt, you need to reduce sodium. And sodium is seen in most processed food. So cutting down processed food will help in bringing down the blood pressure. If you're overweight, reducing body fat helps. According to various research and studies, per kilogram of body weight that you lose, your body will be able to bring down your blood pressure by around 0.7 to 1 millimeters of mercury. So if you lose 10 kilograms of body fat, you can bring down your blood pressure by around 10 millimeters of mercury from both systolic and diastolic. How cool is that? Including potassium-rich food, including omega-3, including magnesium-rich food. These are all things which will also help in bringing down the blood pressure naturally through a lifestyle change. Of course, there are medications which your cardiologist or physician or doctors would have prescribed. These medicines, some of these medicines, quite interestingly, what it does is that it increases the diameter of the blood vessels and reduces the blood pressure. Some classification of drugs do that, in fact. So it's extremely important not to tamper or play around with the dosages without your doctor telling you to reduce the dosages if you're ready for it. And how will you be ready for it? Through these kind of structured, scientific and sensible lifestyle choices. If you're more interested and keen to know more about it, do reach out to us. My name is Rajiv Ambat. We are an online health and wellness company called NuvoVivo, which works with clients across the globe and help them manage lifestyle diseases such as hypertension, diabetes, other cardiovascular disease, high cholesterol or dyslipidemia, PCOS, fatty liver, etc. All right, so I hope this information was helpful. Stay healthy, stay fit, stay young, and take care.